Thanks everybody for coming out. Apparently, when the bill passed on Sunday, it didn't mean that the issue was over, like they claimed. In the wake of that, I think it's worth initially just quoting Dwight Eisenhower. You may remember that December 16, 1944 was the start of the Battle of the Bulge, and things didn't look too good. The Allied forces, particularly the Americans, were completely unprepared in that area because no one figured that they could possibly bring an attack through the Ardennes forest again in the middle of winter. But they did. And 3 days into it, things were not looking too good. There were literally tens of thousands of American POWs, and we didn't realize that the German forces were actually running out of fuel, running out of ammunition, and things didn't look too good. So General Eisenhower, at that point, in his first big meeting, once the some intelligence came back, and this is what he said to his senior staff, said that the present situation is to be regarded as one of opportunity for us and not disaster. That's how we need to view what happened this past week with regards to health care. And with the help of all of you and people all over the country, we will take back this country, ensure that health care and health care reform puts patients first, ahead of government and whoever they want to have be in charge. I think it's worth starting with a story. As Tom mentioned, in my day job, I'm an orthopedic surgeon up in the Glendale area. I take about 14 days of call a month at a couple of different hospitals and can give you the story, which is something you already all know, which is how, at the end of the day, there is nothing more personal than our health and health care. And it is absolutely impossible to think that the decision-making power placed thousands of miles away will ever result in health care being better for all of us. The two stories start out fairly similar, actually. In both cases, it was a woman with a fair number of medical problems and about 82 years old who still got around, but both fell at home and both broke their hip, which is how I came to meet them. Well, for those of you who know people or may have been in that situation, after you break your hip and end up in the hospital, it's not exactly your finest moments. You don't quite get the makeup onto your hair. So when I see those folks in the hospital, they never look too terribly good. And on paper, they actually look incredibly bad. And so the concern always is this someone, the first decision with a hip fracture is, well, is this someone who you're going to treat with an operation or not? Well, on paper, in both cases, you say, gosh, I'm not sure how things are going to turn out. Well, in the first case, it was a lady, again, who really looked in bad shape. She couldn't even really talk for herself with a combination of pain medication. She hadn't really taken anything to eat or drink. But the family said, you know what? Before she fell, she was getting around really quite well. And you look at them and say, oh, I guess so. Can't see it at the moment. And we really think that the best thing for her, after understanding all the options, is to go ahead and have an operation, because we think this is the best thing for her. Well, I can tell you that in my 24 years of taking care of patients and in my 15 years of orthopedics, one of the more satisfying things was getting a phone call, that was in November, the following Easter, from the family saying that their mom and grandma just came in walking on her own power with her walker into Easter dinner. And that's why we do what we're doing. And there are stories on the other end too, with folks with the same problem. Again, this is much more recent, where you have a very long, very difficult conversation with the family, but the decision is up to the family. And in that case, they made the decision that what was best for their mom was an entirely different path. That fundamental right of patients and families to remain in control of their own health and healthcare decisions is why I've been involved in healthcare for the last last over 2 decades, and why I continue to be in healthcare today, and why I believe that it is worth fighting for to the very, very end. Before I transition a bit into what the Arizona Healthcare Freedom is about, I want to just real briefly, Representative Gifford's been explaining her vote. And so I want to dispel a couple of quick myths, and then we'll do questions at the end, and you can ask anything you'd like. But the first one, of course, is that this is somehow going to, quote, decrease the deficit by $138 billion. Well, it does that if you don't include the fact that you actually need to pay people to provide health care. And while it is their goal, perhaps, not to pay people who provide health care or anything, it is unlikely they will get away with it. That $138 billion of, quote, savings turns into about $150 of, quote, deficit, once you count those numbers in alone. Then when you start adding in money that's really being earmarked from other dedicated programs as, quote, savings, and then use it to pay for the new programs, you can pretty quickly get to a total of about, on the low end, about $550 billion of additional excess spending, almost no matter how they choose to try to tax us to pay for it. So with due respect to Congresswoman Giffords, I believe she's wrong. Second thing comes down to whether or not people are going to be able to keep what they have. One of the ways they get the magical savings is to cut Medicare Advantage payments to insurance companies. I will be the first to tell you there is no love lost between me and any insurance provider, public or private. Trust me. But Medicare Advantage, as it's evolved over the last 7 years, has become a fairly remarkable example of how a subsidy program that's available to all seniors has actually provided significantly increased options for seniors to get health care. One way we know that is, it turns out that the Medicare Advantage, the private plans, are effectively one-stop shopping in many cases. You have your standard Medicare, you don't have to have a Medigap policy, and you also have your drug program all rolled into one. And in many cases, they can do it with out-of-pocket payments that are very less than if you had to do all 3 things separately. Well, they didn't need a government program to go out and tell that to people. For example, we know from the data that if you look at Hispanic Latino seniors who are eligible for Medicare, 80%, that is 8 in 10, of all Hispanic Latino seniors who are eligible for Medicare with incomes of less than $20,000 a year have a Medicare Advantage plan. And when you cut these payments by $132 billion, as they do under the reconciliation bill that was just passed today, it is a 100% guarantee that not just those folks, but any of you here and people you know all around the country are going to wake up in 2011 and discover that your costs are going up, your benefits are going down, or you may lose what you have entirely. One more point, real quickly. One of the big things they were touting, of course, in the bill that only a few of them ever read, was that when the bill passed, children would immediately be able to get insurance without any pre-existing conditions. Well, when Nancy Pelosi said we're going to have to pass the bill first to figure out what's in it, that apparently applies to the Democratic caucus as well. Because it turns out there's nothing in the bill that eliminates pre-existing conditions for children in the bill. So it's yet another place where, in what Congresswoman Giffords is sending out, I would say differs from the reality. Because in healthcare, the details really do matter. Also, as Tom mentioned, back in 2006, look, healthcare was on an unsustainable fiscal path for this country for a long time. And in the second half of 2006, it became clear to me that unless we act and act decisively to protect the rights of patients and families to be ultimately in control of their own health and health care, that when, quote, healthcare reform came, those rights would be lost. Well, unfortunately, what we learned over the last 12 months is that was true. what we saw is special interests spend $600 million lobbying so that they can take over 1/6 of the U.S. economy, and just as importantly, control over what is now 1 out of every 8 jobs in this country. So they were pretty successful. It turned out to be a pretty good investment for them. What came out of that basic idea with the help of a lot of really smart people was what became Proposition 101, which is preserved in the Arizona Healthcare Freedom Act.